If you're watching this video, there's a good chance you're dealing with something that deeply embarrasses you, something you can't talk about with your wife, your friends, and can barely admit to yourself. Maybe you've tried and couldn't. Maybe the erection starts but doesn't last. Maybe you simply avoid intimate situations because the fear of failure is greater than desire. And maybe, just maybe, you've convinced yourself this is just part of getting older, that there's nothing to do except accept it. Let me stop you right now. I'm Dr. Michael Turner, urologist, and I'm going to tell you something that could change your life. Erectile dysfunction is not an age sentence. In the vast majority of cases, it's a symptom of something treatable, and more importantly, it can be the first warning that something very serious is happening with your heart and blood vessels. Today, we're not going to have shame, no beating around the bush. We're going to talk man to man with science, respect, and real solutions. Stay until the end because what I'm about to reveal might not only restore your intimate life, but literally save your life. Welcome. I thank you for your courage to be here. I know it wasn't easy to click on this video. Erectile dysfunction, or ED as we call it, carries an enormous emotional weight. It attacks directly at your identity as a man, your self-esteem, your relationship. In over 20 years as a urologist, I've seen thousands of men sitting across from me, looking at the floor, voice low, struggling to find the words. And I always say the same thing: you're not alone, and it's definitely not your fault. Here are the facts. Studies show that more than 50% of men between 40 and 70 experience some degree of erectile dysfunction. After 70, that number rises to over 70%. But here's what most don't know. This statistic does not mean it's normal, or that you should just accept it. It means there's a silent epidemic of vascular, metabolic, and hormonal problems that aren't being adequately treated. Erectile dysfunction isn't the problem, it's the symptom. It's your body turning on an emergency light on the dashboard, screaming that something isn't working right. And here's the part that can save you. ED frequently appears 3 to 5 years before a serious cardiac event like a heart attack. Why? Because the arteries of the penis are smaller, thinner than those of the heart. When there's a process of atherosclerosis, of artery clogging, it shows up first down there. It's nature's early warning system. Ignoring erectile dysfunction isn't just giving up on your sex life, it's potentially ignoring a warning that your heart is in danger. Let me tell you about Robert, 62 years old, successful businessman, married for 35 years. Robert came to my office, pushed by his wife, Martha. He'd been avoiding intimacy for almost a year. Martha thought he was having an affair. The truth was, Robert couldn't maintain an erection. He'd experienced some failures, and fear set in. The more he worried, the worse it got. He told me, with tears in his eyes, "Doctor, I feel less than a man. I feel like I'm disappointing the woman of my life. I'd rather avoid it than face the humiliation." We did a complete evaluation. Robert had high blood pressure he didn't even know about, was overweight, sedentary, and his testosterone levels were rock bottom. But most concerning, his tests showed early signs of arterial disease. His erectile dysfunction wasn't psychological. It was vascular. It was the first sign that his arteries were clogging. We started aggressive treatment, lifestyle changes, blood pressure medication, hormonal adjustment. Within 3 months, not only did his erectile function improve dramatically, but he literally avoided a path that could have led to a heart attack. His ED saved his life. Now let's understand exactly what an erection is and how it works. Many men, surprisingly, don't know. An erection is essentially a vascular event, a blood vessel event. The penis has 2 spongy cylinders called corpora cavernosa. When you're sexually stimulated, either physically or mentally, your brain sends signals through nerves to these cylinders. The arteries that bring blood to the penis dilate, open wide. Blood rushes into the corpora cavernosa, filling them like a sponge absorbing water. At the same time, the veins that normally drain blood are compressed, closed, to keep the blood trapped inside. Result: the penis fills, hardens, becomes erect. For this to happen perfectly, you need four things working: healthy and unblocked arteries to bring the blood, intact nerves to send and receive the signals, healthy muscles and tissues of the penis, and very importantly, hormonal balance, especially testosterone. If any one of these four pieces fails, the erection fails. And that's exactly where the problem lies. Let's break down the main causes. Cause number one, vascular disease. Clogged arteries. This is by far the most common physical cause, especially after 50, atherosclerosis, is the buildup of fat, cholesterol, and calcium plaques in artery walls. This process begins silently over decades throughout the body. When the arteries that bring blood to the penis become narrowed or blocked, not enough blood arrives. Without flow, no erection. Simple as that. And the same risk factors that clog the arteries of the penis are the ones that clog those of the heart. High blood pressure, high cholesterol, diabetes, smoking, obesity, sedentary lifestyle. If you have erectile dysfunction and any of these risk factors, you're in a process of systemic vascular disease. Your entire body is being affected. Cause number two, diabetes, the silent destroyer. Diabetes is one of the worst enemies of erectile function. First, high blood sugar damages nerves, including the nerves of the penis that control erection. This is diabetic neuropathy. Second, diabetes enormously accelerates atherosclerosis, clogging arteries faster. Third, diabetes affects the production of nitric oxide, a crucial molecule that relaxes vessels and allows blood flow. Studies show that up to 75% of men with diabetes have some degree of ED, and many discover they have diabetes precisely because they seek help for erection. Cause number three, low testosterone, the forgotten hormone. Testosterone isn't just about muscles and aggression. It's absolutely essential for sexual desire, libido, and for the actual mechanics of erection. With age, testosterone levels naturally drop, about 1% per year but in some men, this drop is much more pronounced, leading to hypogonadism. Symptoms include not just ED, but also fatigue, loss of muscle mass, gain of abdominal fat, depression, and loss of motivation. Many doctors don't check testosterone routinely, so men suffer unnecessarily. Cause number four, medications, the erection thieves. Several common medications destroy erectile function as a side effect. The worst culprits are certain blood pressure medications, especially beta blockers and thiazide diuretics. Some antidepressants, mainly SSRIs like fluoxetine and sertraline, are notorious for causing ED and loss of libido. Ulcer medications like cimetidine, some prostate medications, and even anti-inflammatories used chronically can contribute. The problem is that many men start a medication, the erection worsens, but nobody makes the connection. They think it's age. Cause number five, psychological factors and the cycle of fear. Although most cases after 50 have a physical basis, the psychological component should never be ignored. Performance anxiety is huge. You fail once, and the fear of failing again creates a self-fulfilling prophecy. Your brain is so busy with fear that it can't send the arousal signals. Depression, chronic stress, relationship problems, all can suppress desire and make erection difficult. Frequently, it's a combination. An initial physical problem creates occasional failures, which generates anxiety, which makes everything worse. Now for the solutions. But before we talk about blue pills, we need to talk about the protocol that actually treats the root of the problem. This is the 5-step vascular protocol. Step 1, complete and urgent medical investigation. Before anything else, you need to do a complete cardiovascular evaluation with your doctor. Blood tests for glucose, glycated hemoglobin, complete lipid profile, total and free testosterone, TSH for thyroid. Check blood pressure properly. If you have risk factors, You may need a stress test or carotid ultrasound to assess your arteries. Don't skip this step. Your life could be at stake. Step 2. Attack risk factors with total war. If you smoke, stop. Don't reduce. Stop. Smoking is one of the worst destroyers of erectile function. If you're overweight, especially with abdominal fat, lose weight. Just 5 to 10% loss already dramatically improves function. Rigorously control blood pressure and diabetes. These aren't just numbers, they're the actual causes of your dysfunction. Step 3. Movement and cardiovascular exercise. Regular exercise, especially aerobic, improves endothelial function, meaning the ability of your vessels to dilate. Brisk walking, light jogging, cycling, swimming, 30 to 40 minutes, 5 times a week. This isn't optional, it's therapeutic. Studies show that men who exercise regularly have a 30% lower risk of developing ED, and those who already have it improves significantly. Step 4. Nutrition focused on vascular health. Your diet needs to protect your vessels. Mediterranean diet is the most studied and effective. Lots of vegetables, fruits, fatty fish like salmon and sardines, rich in omega-3, olive oil, nuts, whole grains. Foods rich in nitrate like beets and leafy greens help produce nitric oxide, improving flow, drastically reduce sugar, white flour, processed foods, trans fats, moderate alcohol, as excess depresses the nervous system and reduces testosterone. Step 5. Consider natural supplementation with medical approval. L-arginine and L-citrulline are amino acids the body converts to nitric acid. They have modest evidence of helping. Korean red ginseng has some positive studies, but be careful. Supplements aren't regulated like medications. Always discuss with your doctor, especially if you take heart medication. Now let's talk about medications. The PDE5 inhibitors, Viagra, Cialis, Levira, and similar. Do they work? Yes. In many cases, they work very well. They block an enzyme that destroys nitric oxide, allowing the vessels of the penis to stay relaxed and receive more blood. But attention, they are not the solution, they're a tool. If the cause is vascular, taking the pill without treating the underlying disease is like putting a Band-Aid on a clogged artery. Additionally, these medications have serious contraindication. If you take nitrates for the heart, you can never use these drugs, as the combination can cause deadly blood pressure drop. If you have severe heart problems, it may not be safe. That's why medical consultation is mandatory, and testosterone replacement. If your levels are provably low and you have symptoms, replacement can be transformative, improving not just erectile function, but energy, mood, muscle mass. But it must be done under rigorous supervision with monitoring tests, as there are risks and contraindications, especially if there's suspicion of prostate cancer. Back to Robert, my patient. After 3 months on the protocol, 12 kilos of weight loss, regular exercise, blood pressure control, and a little initial help from Cialis when needed, he told me, "Doctor, I feel 40 again. Not just the erection came back. My energy came back. My confidence came back. My marriage has never been stronger, and knowing I'm protecting my heart gives me a peace I haven't had in years." To conclude, I want you to remember this. Erectile dysfunction is not shame, not weakness, and not the end. It's a signal, a warning from your body. And in most cases, it's treatable. But you need to have the courage to take the first step, to seek help, to do the tests, to change lifestyle. Your sex life can return, your health can improve, and you can avoid much more serious problems. If this video gave you hope or knowledge you didn't have, do 3 things. First, subscribe to this channel for more honest information about men's health. Second, share this video. You might literally be saving someone's life. Third, schedule an appointment with a urologist or cardiologist this week. Don't wait. Your function, your health, your life are in your hand. And I'm here to tell you, there is hope, there is treatment, there are solutions. I'm Dr. Michael Turner, and my mission is for you to live with health, vitality, and dignity in all areas of your life. Take care of your heart, take care of your vessels, take care of yourself. Until the next video.